Good morning. It's Dr. Jay Faber from the Amen Clinic. I thought I'd do another video this week and kind of give you my appraisal for the next 5-6 days of what the virus may or may not hopefully do in this country. We had a great response last week, and I thought we might want to shoot another one out today. By the way, if you like this, find it helpful, please share it. We want to empower people towards health and wellness and certainly not getting this virus. So the whole purpose of looking at numbers is not to look at data just for data's sake, but to really make a difference and impact and change. So that said, I've got some really, I think, good news. I've got some news we got to watch real closely and get really concerned about. And then 3, what can you do as a person, as a family member, as a community member to help get this crisis done? So let's start with the good news, and I'm going to share my screen with you first. So allow me to go to my computer, and I'm going to put up a completely new site. This is a new data site. We looked at the Johns Hopkins last week. This is another one you can download and for the most part get real-time metrics from Worldometer. I found them looking at data a little bit differently and extremely helpful. Here's the good news. This is yesterday, March 29th, the statistics in the United States per state. The good news is if we go across, here's the total number of cases per state, but new deaths. Okay, these are the unfortunate people who passed away, our mortality. Yesterday we had, sadly, 362 people pass away. That said, however, if we go down a little bit further, look at this. Here is the daily mortality rates. The absolute number of people who passed away went from March 28th, 525, down to 362. So let's see and hope this continues. I mean, I've been in medicine long enough to know that it doesn't always stay that way, but that is good news. The other piece I would throw in here is if you look at New York, yesterday they had by far the most people who passed away, 180. But if you go the previous day, so March 29th to 28th, they had approximately 280 people pass away. So we've seen a fairly precipitous drop in New York. Now, why is this? Is this because of some of the new medications that have been utilized, the chloroquine, hydroxychloroquine, the azithromycin, the remdesivir? We need to follow this closely because if these medications are showing this drop, this is extremely good news. Okay, now, this is the data I'd be watching closely, and we want to watch very astutely the next, I'd say, 5 to 7 days. So here are the United States data. I can actually go back by country and look at who's got the virus. Okay, so United States, by far right now, we've got the most cases, 145,000. Italy, God bless Italy, they've been really going through it. They have 739 cases as of right now. Okay, now, let me get my calculator, if my computer will allow me to do it. Here we go. All right, so let's play with some numbers here. In Italy, we've got 101,739 current coronavirus cases. If we take that number and divide it by the total population of Italy, which is about 61 million, we get a penetrance rate of 0.001667, blah, 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 blah. This is the of all the people in Italy, roughly 16 out of 10,000 are getting the virus. Now, Italy's probably a few weeks ahead of us with this whole virus, so you kind of start saying, well, if that's what's going on in Italy now, where's U.S. headed? Okay, so let's do something here. Let's take this number and multiply it by the population of the United States, 331 million. And that might give us somewhat of an estimate, not perfect. Again, we're using these numbers, so things could change, of how many people in the U.S. could potentially have this illness in 1 to 2 weeks. And we come up with a number of 552,059 people. Now, what does that mean? It means currently we're at 145,531. If these numbers pan out, we'll probably see a lot more people in the U.S. get the coronavirus. Okay, now part of this might be because we're doing better testing. Part might be because the virus is actually spreading. Could be a lot of things, but if we know ahead what to expect, we can stay calm, which by the way is probably a good thing for our immune system, and take proactive steps today to try to help that number hopefully be even less. Okay, now that all said, where is this going and where do I think we need to watch this week really closely? Let me pull up something else from this site that I find really, really helpful. Okay, if I go down to this graph here, active cases, this is worldwide. There's 761,000 active cases, of which 95%, about 530,000, are in the mild condition, and about 29,000, 5%, are in the more severe condition. Okay, so strategically, what do we want to do for each of these groups? The severe condition are probably the people who are in hospitals right now, all right, or going to the hospital. These are the people that are getting the new medications, the chloroquine, not new medications, but medications we're starting to use, hydroxychloroquine, chloroquine, azithromycin, the remdesivir. These are the people that are getting the meds, and we're going to watch these mortality rate to see hopefully if that continues to go down. Then, for those of us who aren't in the hospital, we have either a mild condition or just aren't sick at all, what can we do this week to make an impact? What can you do? What can your families do? What can your communities do? Let me throw out a couple ideas for you. One, we've got to isolate. We've got to stay away from people, at least for this week. Keep your distance. Two, I think we got to really work on building our immune systems. Right? That could be from diet. Okay, you can look at lots of places, but big thing is stay away from your sugars, stay away from your saturated fats, eat healthy, eat well, and then second, start to find educational tools to learn how to build up your immune system. I'm not going to do that now, but I'm going to tell you this. Dr. Daniel Amen, renowned psychiatrist at the Amen Clinic yesterday, did a big piece on how you can build your immune system. If you go to our Facebook page, Amen Clinics, you'll get information, or just go to the website, www.amenclinics.com. Second, Dr. Kaban Shapik, another doctor, actually did a video that is on Facebook that you can get information right now as soon as you get done with this video. 3, and I'm going to do this starting tomorrow. My commitment to you is this. Once a day, I would love to reach out and speak to you direct using our resources, our Zoom, which has been awesome through this telehealth, and give you some personalized guidance on what you can do for your immune system. If you call my direct office line, 818-479-4400, one person per day for 30 to 60 minutes. We'll talk, we'll chat, we'll see what your concerns are. We'll talk about immune system and what you can do and make an impact for yourself and the community. If you have more than one person, you want to have a group, all the better. But I really want to offer my personal touch for my education, which has, by the way, gone way beyond psychiatry into functional medicine to help you out. Okay. Next, we've talked a lot about what you can do, but you know what? I have just not seen much about. What can we do to get rid of this virus? And are there things we can do to help get rid of the virus? So yesterday I started doing my own search saying, beyond medications, is there other ways this virus is vulnerable? There's not much on COVID-19, but there is information just on the coronavirus in general. And I wanted to share you one really interesting article that I had found. This is from the Influenza and Other Respiratory Viruses Journal from 2014. And what they looked at is this. This is the MERS virus. If I go back to the top, heat inactivation of Middle East Respiratory Syndrome, that's MERS, it's a coronavirus. And someone did a study, and they took the virus, put it in like a test tube or some kind of an isolate form, and heated up the virus to see if it would die. Okay, because if it can die, that would be certainly one way to get rid of it. Now, interestingly enough, and I'm going to go through some of the details quickly, they had two groups. One group, they put viruses in test tubes at 56 degrees centigrade, which is approximately 134 degrees. And then they had another group where they put the virus in test tubes at 65 degrees, which is approximately 149 degrees. Now, what they did is they followed over time to see what happened to the virus counts over 120 minutes, so 2 hours. And the group heated at 56 degrees, they all started off with about 10 to the 5th, 10 to the 6th, 10 to the 4th, somewhere, about 20, 30,000 to a million viruses per test tube. At 15 minutes, a virus was still found. By the way, if you see a 10, there's still virus. ND means it's gone. 30 minutes, there's still virus here. 60 minutes, no virus. But then 120 minutes, there's still virus present. Now, when they heat it to 149 degrees, 65 degrees centigrade, look what happens. Here's the number of bacteria, from 10 to the 3rd to about 10 to the 4th. So somewhere between 2,000 to 20, 30,000 viruses at 30 seconds. 15 minutes after being heated at 15 minutes, no virus. 30 minutes, no virus. 60 minutes, no virus. 120 minutes, no virus. The virus is gone. Now, from a translatable approach, what does this mean, or what could it mean? Okay, one, it's not the COVID-19. This is another coronavirus, though, that appears to be very susceptible to heat. What if COVID-19 is susceptible as this virus? And what are things we might think about looking this week to try to help our families and our communities? Are there ways or places we can go to sit for maybe 10 to 15 minutes, if we go by the second group, where it's 149 degrees? All right. One of the biggest places we might really consider looking is saunas. Saunas, from my research, can get up to 180 to 195 degrees. What if people were able to sit in saunas for 10 minutes and try to get rid of the virus that they're exposed to? What if, especially apartments or condos, and God bless New York where you've got a lot of these, what if in each lobby you had a sauna or two saunas where people, before they go to the room, they had to go into a sauna, sit for 10 to 15 minutes, de-sterilize, and then go to your room? What would be the likelihood of us helping that virus go bye-bye and not be prone to being around a bunch of different individuals? Let's get creative. Let's get innovative. Business people out there, operations people, feel free to send me messages and feel free to share this. I'm here. And remember, 818-479-4400. Once a night, I'll be more than happy to speak with somebody for 30 to 60 minutes to help you. God bless you. God bless our country. And by all means, let's make this a hard-working but very results-oriented next 7 days. Bye-bye.